Hi, I'm Esteban, and I got some really exciting news. We have combined 2 courses into one for our cervical course, and it's still going to be just 2 days. So the lower cervical course is one of my favorite courses to teach, and I love the added material from the upper cervical spine from C01 and C12 because one of my favorite type of patients to treat are patients with headaches. But when I teach the lower cervical spine, I feel a little guilty because I'm like, you know how to treat most of the stuff with the spine, but you really can't do it totally and effectively if you don't include the upper cervical spine. C01 gives you 50% of the flexion extension from the neck. C12 gives you 50% of the rotation. So those 2 segments are so key to no matter what you're treating in the neck. So now you get all the course material of those 2 courses into one. My goal in these courses is to teach you the most common pathology that we treat in the clinic and make sure you can diagnose those and treat them effectively, and in the course starting to get good at treating them well. Not just expose you to a couple techniques and move on, but we're going to spend longer in your labs so you develop good manual skills, good critical thinking, and a little more breaks in the course so we have fun and you don't feel as overwhelmed. We've updated the cervical exam, so now we don't have 2 separate exams. You got your basic clinical exam, and you have your extra test and your mid-cervical exam for provocation of the facet joints, and your local exam all on front and back side and condensed. Some course highlights: I want you to be able to diagnose internal disc disruptions, protrusion, prolapse, extrusions, joint disorders like facet joint synovitis, facet arthrosis, uncovertebral joint arthropathy, and even costotransverse joint arthropathy, all within this course. Not only how to diagnose them, but how to treat them well and give your patients self-management strategies. A new study just came out that patients with low back pain, even though I'm talking about the cervical course, this just came out so I snuck it in, is patients with low back pain want a diagnosis. They want to know what's wrong with them. They want a prognosis. They want to know how long it's going to take to get better. And they want treatment options and self-management strategies. We cover all of that in every course. We're going to do case studies. We're going to have case studies that you could do at home. We're going to give you several case studies per course. We're going to have some case studies with full PowerPoint presentations that we're going to record our voiceover so you can understand the differential diagnosis process. During the course, we're going to go through some, and after the course, you'll have access to some. And then during those PowerPoints, we're going through treatment programs per pathology. So if they have a cervical protrusion, we're going to talk about how we diagnose that, and then different treatment strategies. Then we're going to take you through that spectrum. During the course, I want you to separate your brain and think about both identifying the pain generator and also the dysfunctions. So we're going to look at different systems of dysfunction. We're going to look at soft tissue dysfunctions, segment dysfunctions for the disc and the joints and the nerves. We're going to look at dysfunctions of the biopsychosocial system and how to address those. And we're going to look at how to address and assess the sensory motor control dysfunctions that are very common, and just even some basic exercise, taking you through a whole exercise program from start to finish, teaching you how to do that. We're going to do a lot of lab time, more lab time than usual, so you have time to switch partners. You have time to work on techniques and review techniques that we did earlier in the course and start blending techniques. We're going to do soft tissue. We're going to do joint mobilizations. We're going to do axial separation. And I want you to keep practicing them and get good at them and make each technique feel good. Not just that they look good and they're technically correct, but they feel good. But that takes time, so we added more manual therapy lab time. I have new photos that I've taken. I've taken many, many photos. I pay someone to knock out the background so that you can see them bigger, take up more screen without a white background, and then we even started getting some moving GIFs so you can see the technique up close what we're doing on the model and what the anatomy is doing while it's moving. And I gave you my patient profiles per course, so you know how to diagnose things. You can just quickly review. On one slide, it has cervical protrusion. One slide has cervical prolapse. One slide has C1-2 joint arthropathy. One slide has facet joint arthropathy. So if you need a quick review, it's on one slide. And then everything can be crystal clear because it's all written down for you on these patient profiles. Other course highlights is we give you our laser program that we do in the clinic. So we do a lot of sensory motor control with a head-mounted laser. You can purchase one at OPTP, but it is so integral when your patient can get a laser on their head and start tracing lines in the clinic, or a map, or a maze, or they gotta close their eyes and find center of the target. And people with whiplash or concussions, you'll do it and they'll be over here and they're like, okay, I think I'm centered, and they're nowhere close. And we've been using that for over 10 years, but we didn't have a program written down, or we didn't have handouts. And so now that's incorporated in this new cervical course. And handouts on self-care. If you want to keep the range of motion that you gain with your manual techniques, give them augmented exercises. Exercises that are designed to work or to mimic what we're trying to improve with our manual therapy techniques. So we have handouts for that. And it's a hybrid course, so it's going to be a lot of online material. So when we come together in the live course, we have more time for the fun stuff, the manual therapy, the case studies, and more time to refine skills and get better. So I'm so excited for this new combined course, and I hope to see you there.